All right. Good morning to everyone. I'm Jasiang. Going to Prof. Shanga, Prof. Benjamin, all the medical students, and all my colleagues here. So, warm welcome to every one of you. I'm Jasiang, the current advisor for Malaysian Medics International MMI. So, some of you might remember me from the faculty of UM or previous MMI activities. I had the pleasure of learning under Prof. Shanga's guidance during my surgical posting and also during my elective posting at the National University of Singapore. So with Prof. Benjamin. So I really glad to see this event being put out by my MMI committee and also the NUS Urology Students Interest Group. So thanks everyone for attending this event in the early morning, I think 9 a.m. right now. It's a truly very precious experience to have the presence of both Prof. Shanga and Prof. Benjamin at our first MMI Malaysia event in term 2023 and 2024. And actually, I'm very glad to see Susan and Chloe, our current president and vice president of MMI Malaysia, lead a great team and collaborate with the NUS Urology Student Interest Group to bring this event to life. So to all the participants here, after this event, if you think that this event is very good, you would like to see more event like this, a collaboration event between Malaysia and Singapore or the other country, do let us know after the event so that we will have more collaboration chance with the other country after that. All right. So let's introduce a bit about Prof. Shanga and Prof. Benjamin. So actually, I still can recall my elective posting when I was doing my elective posting in NUS under Dr. Melissa, and I had an opportunity to witness Prof. Tiong's in several kidney transplant surgeries. So Prof. Tiong is their transplant surgeon, and he actually suggested me to collaborate with their student interest group for this event. And I decided to pass the opportunity to MMI Malaysia for their first opening event of this term. And this is what we have right now. But then after I returned to Malaysia and during my second posting, I had 2 weeks of urology teaching with Prof. Shanga. So when Jivan asked me to recommend a speaker for urology surgery, my immediate thought was Prof. Shanga, because his teaching is very good, provide a lot of guidance to you. So I will hope that during this event, all of the participants will learn a lot from here. All right. And once again, thank you all for being here. And I hope we can make this event an unforgettable experience for everyone involved. I will pass it to the next one.
So I'm Nicholas and I'm going to be the moderator for today. So first and foremost, I'll pass it on to our president, Suzanne, to give her opening remarks.
Thank you, Nicholas. Okay, hi, good morning, everyone. So, thank you for joining us on a Sunday morning. But before I start, I want to say a good thank you, and I am very grateful to the team that have organized this event, our first event for the term, and this is our first collaboration with Singapore as well. And let me take some time of yours to introduce what MMI really is. So MMI is actually a student-led organization established since 2013. And we are actually a branch council under MMI called MMI Malaysia. And we focus on according to the 3 mottos, we connect, educate, and cultivate. So I'm also very happy to have 2 wonderful professors, very knowledgeable professors, Prof. Shanga and Prof. Ben, to be able to take their time out of a Sunday morning to come and share knowledge with our participants and with all of us here. And last but not least, I also said in the beginning, I am very thankful, and I want you guys to give a round of applause to our committees that are like the backbone of this event. They have worked very hard to ensure this event is a success. I hope you guys will be able to gain something from this event and have fun listening and learning something in this Sunday morning. I'll pass back to you, Nicholas.
Thank you for those words, Suzanne. So now let me start the session. So good morning and welcome to the first event of MMI this term, which is in collaboration with NUS Urology Interest Group. So first and foremost, I would like to start by introducing our esteemed speakers. So Dr. Shanga is currently a urologist and academician in UMMC and has been there since 2005. He is also part of the Malaysian Board of Urology Training. He has a special interest in uro-oncology and renal transplant. He is very dedicated to teaching as he teaches both undergraduates and postgraduates. So moving on to Dr. Ben. Dr. Ben is a distinguished urology consultant whom graduated from NUS in 2008. He has subspecialized in the field of robotic kidney surgery and kidney transplantation at London's Royal Free Hospital. He is currently practicing in NUH and is the medical undergraduate director at U Lulin School of Medicine in US. Now, I would like to invite the speakers to say a few words about themselves, starting with Dr. Shanga.
Hi, very good morning to all of you. Thanks to Nicholas for the kind introduction. And I'm very grateful to have been invited as one of the speakers to take part in the discussion with regards to urology pathways, as well as some challenges that you all might face in your career in the future. And I hope I will be able to answer most of your questions and have a very fruitful discussion this morning. Thank you.
Okay, next, we
Thank
move
you.
on to Dr. Ben.
Thank you, Nicholas and committee for organizing this event. So I'm really appreciative when initiatives are student-led, and it's no mean feat to have a conversation across two countries and to see what are the similarities and differences. So I hope it'll be a good morning of discussion, and we'll be happy to answer any of the questions that you might have to the best of our abilities.
Okay, thank you, doctors. So let's address the elephant in the room first. So since we have a large audience from various years of medical school and even some from pre-university before their medical school, could doctors enlighten us on what does a urologist do and what does the job entail as a whole? So maybe we can start with Dr. Ben first.
Sure, thank you. Urologist. I think a urologist is many things, and I'll be biased in this, right? So I think urology is one of the specialty that is hands-on, so a bit like general surgery, cardiothoracic. So we do a lot of hands-on as part of our daily work. Urology is really broad in the platforms that you can use to do surgery. So urology takes care of systems of the genital urinary system, so kidney, ureters, bladders, penis, scrotum. And because of that, we manage a whole host of cancer, right? And we probably have the most types in a subspecialty. And because of that, I find it really interesting that we operate across different platforms, from open surgery, laparoscopic surgery, robotic surgery, transplant surgery. And then I have colleagues who do fertility, sexual medicine, and reproductive medicine. Then we have colleagues who do a lot of reconstruction, pelvic floor incontinence. And because of that, then they will use microscopic surgery, implant surgery. So I think it's a really broad spectrum, and that's just the clinical part. To me, urologists also participate actively in research. So there are lots of cutting-edge urology research with new technology. And for myself, education. So I think urologists around the world participate very actively in medical education, both undergrad and postgrad as well. So that's probably a big way of how I see what urologists do, which is broad.
Yeah, that is a very broad explanation. I didn't know there was such a broad field in urology on its own. Thank you, Dr. Ben. Dr. Shanga, maybe you can add your opinions as well.
Yeah, I mean, I agree with Prof. Ben. Actually, the breadth of urology is immense. Actually, you can actually still be a physician. If you in urology, you can also be a physician because there are a lot of conditions that actually can be treated by medicine. Actually, you can use medical therapies for urological condition. It's not all about surgery. So why I chose urology last time when I was thinking what shall I do after being a surgeon. Choosing urology at that point was one of the options, because you can still include a lot of medical therapies in urology, and you would find that the surgery that you do in urology is very wide compared to any other surgical specialties, actually, and the use of technology in urology, the what do you call that, advancement in technological usage in urology is fantastic. I think you would agree with me, Prof. Ben. So much technology in urology, lasers, all kind of endoscopic procedures, robotics, everything comes to urology, actually. So we are like one of these, uh, forgive me, if you don't, if there are someone in the audience who like other fields of surgery, but I think we are the we are the division or department where we use a lot of technology, and we are quite pampered, actually.
Yeah, me myself, I'm interested in cardiothoracic surgery, doctor.
Oh,
But I
is it?
noticed some common themes there because I was just speaking to Dr. Siva Kumar the other day from UMMC.
Mm-hmm.
He was also saying how cardiothoracic surgery isn't just about surgery. You have to be the intensivist, you have to be the physician as well. So I
Correct.
see some common themes there in regards to the bridge between different specialties. So thank you for that very informative explanation on what the broad field of urology really is about. Next, I'm sure a lot of us, especially medical students in the clinical years, are very interested to find out on the pathways to specialization to becoming a urologist in Singapore or in Malaysia. Could doctors please elaborate on each of your respective journeys from med school to becoming a urologist first, and maybe the current pathways that have maybe changed over the years from doctor's time? So we can start with Dr. Shanga.
Okay. So maybe I just briefly say about my pathway first. But mine was an up and down kind of pathway, so a bit of a sad story in between. But I'll just include that because that is life, That is life, So just let me tell you my experience, lah. Okay, so first, I actually graduated from med school in 1995, actually. Okay, finished, and then I came back after a house because I graduated from India. So I had to do a 1 year internship there, and then came back in '96. Had to do when we joined medical services in Malaysia, our housemanship duration is just 1 year. Okay, so once I finished my 1 year housemanship postings, I was posted to Pahang and wanted to become a GP. Actually, was very interested to become a general practitioner. But by some turn of events, I was posted to the surgical department, and then I got very interested in surgery at that time, So, so, being interested in surgery, the natural pathway was to join Masters of General Surgery, which was the only pathway at that time for Malaysians to become surgeons. So I joined I finished my compulsory service, joined the Masters of Surgery in 2000, and then passed out in 2004. Then after gazettement as a general surgeon, I was actually, because I did my Masters in I actually got offered a post to come back to to become a lecturer in lah, because sometimes, when you all next time join your master's program in any universities, the universities will always be looking at you, who are the potential people who can be, hired to become lecturers in our university, because we need lecturers, you see. So I mean, fortunately, I was one of those who were identified. So when I left for my gazettement, the university actually offered me to come back as a pediatric surgeon. Actually, I wanted to do pediatric surgery. That was my my ambition. So when I joined pediatric surgery, so that time there was this pediatric surgery master's program that was started, like, just first batch, the first batch they were going to take masters in pediatric surgery. So I was very keen to join the program. And what happened was the university actually did not allow me to join the masters in pediatric surgery program, because in Malaysia there's a rule where you can only do one masters, you cannot do two masters, because I had already done masters in surgery. So you cannot become another master's holder. You need to do something like a fellowship to become a pediatric surgeon. So there was going to be a bit of a delay in me going for pediatric surgery fellowship and all that because of service requirement in the unit that was, so they couldn't release me to go for a fellowship and all that, at that time. So a lot of back and forth, unhappiness, why I can't go. I need to, I'm also getting older and all that, so then there was an opportunity in urology. Like that moment, there was an opening in urology where in urology, I will just come to the Malaysian pathway shortly. So there was an opening for a job in urology in UM. So then when I approached the administrators, the management team of the Department of Surgery, they said, okay, they were okay to move me to urology. So when I moved to urology. So basically an accidental urologist, actually. By accident, I became a urologist, So when I moved there, then I joined the urology training program. So at that point, the urology training program was a specialist pathway. Only specialists can join urology in Malaysia at that time. So that means it's considered a subspecialty of surgery. So you become a surgeon and then you become a subspecialist. Okay. So we have a Malaysian Board of Urology under the society, and we had collaboration with the Royal College of Physicians and Surgeons in Glasgow, who actually collaborates with us to conduct the exit exam for urology. And so you join a program where you sit for the exam at the end of third year. And then if you pass, then you continue doing a fellowship outside the country, as well as complete another 2 years. That means a total of 6 years. And then you will get your national specialist registration as a consultant urologist. Okay, so I was again a bit delayed there because at that point I received a scholarship to go to UK for a PhD actually. So I put my urology after I finished my exam in 2009. I did in 2010, because of the scholarship, and I was going to be in academic, I'm going to be in university, right? So it's I'm sure Benjamin will agree that if you have a PhD, your career progression in a university is better, So I actually took up this scholarship and went and did a PhD in UK. So I put my urology training a little bit on hold there, went over, got my PhD, came back, and then I finished the final 2 years that I needed to get my NSR actually, So a lot of breaks in my training, and finally when I got my NSR in 2015, if I'm not mistaken, 2015 or 2016, only then, absolute. I've been doing only urology and teaching at the moment. Yeah, so that's the up and down of my career actually. So sometimes I because of my pediatric surgery posting, I had a bit of a delay there, and then I did my PhD, a bit of a delay there in my urology career. So but it was all required for me to be in the university setting. And to summarize everything, the day I joined medical school in 1990, and to become a fully gazetted urology with national specialist registration, so that came in 2016 actually. So from 1990 to 2016 to become a full-fledged urologist since joining medical school. So how many years is that? So like 26 years, I think, isn't it?
Yeah, so if you don't mind me asking, doctor, how old were you when you got your NSR?
Wow. How old was I? Maybe 40 something, 45 or something like that.
But if let's say if you didn't have all those delays, then how old would someone be if they just took the fastest way without all the delays and everything?
You mean the specialist pathway lah?
No, like in
Because,
your position back then, if someone
okay.
didn't delay to take PhD or wanted to do pediatric, how old would they be if they took just the direct? They already knew they wanted to be a urologist back then.
Okay, so that will be how old will they be here?
Yes.
Maybe about 35, 36.
I see.
Yeah.
So maybe doctor can outline about the current one, because I heard from a lot of people that nowadays they have their own pathway for urology as a master's and not as a subspecialization, much like
Correct.
cardiothoracic surgery. So maybe doctor can enlighten us on that.
So this is called the parallel pathway. Okay, now where we actually have those who have finished their med school, finish housemanship, and then if you fulfill the minimum criteria, which is 2 years post housemanship, and within the 2 years, minimum 2 years, so it can be 4 years or whatever, but within the 2 years, you must have 6 months at least of surgery posting, plus 6 months of urology posting within your rotation. And if you pass your MRCS, okay, if you pass your MRCS, you need your full MRCS, then you can apply to join the parallel pathway of urology. Okay, this is under a program under the Ministry of Health, which is actually the same program that I went through as a specialist. Actually, it's the same program, but now we have opened it up as a parallel for direct entry. You don't have to become surgeon, you can just directly enter this program. Same Royal College of Physicians and Surgeons Glasgow accreditation is there. And once you fulfill the entry requirements, the interviews, the entry exams and all that, then you will then go through a 6-year program as a medical officer in training, go through all the rotations in all the accredited training centers in Malaysia, urology training centers in Malaysia. And at the end of the 4th year, you will be sitting for the exams. Okay, and once you sit for the exams, you clear the exams, then you would be gazetted as a urologist after 6 to 12 months post exams. Okay, then that will also require you to go out to do 1-year fellowship somewhere overseas in the field of your interest. And after 6 years, you will be given an SR. Now, there is a small catch here now at the moment, because there's been some changes in the government policies where all the parallel programs are actually coming under scrutiny, whether we are getting MQA accreditation or not. Okay, so these parallel programs are having a bit of a difficulty getting MQA accreditation because of the training is not very well structured, because the qualification is all based on exam conducted by the Royal Colleges in collaboration with us, you see. So the training, we need to make sure those are accredited training programs. So that's what we are going through now. We are trying to accredit our training so that MQA will approve our program as a full wholesome program for our trainees. So now the medical officers can directly enter. You don't need to become a surgeon first to become a urologist.
So it's much faster in regards to
Much faster.
graduating.
Much faster now. Yeah.
I see.
By the age of maybe 32, you will become a urologist already,
Well, that is very fast. Well,
Yeah.
provided you get into the master's program on the first try lah.
Correct.
Yes.
Yeah.
So that was a very illustrious journey from wanting to be a pediatric surgeon, then PhD, and then after that finally becoming a urologist. Thank you, Dr. Shanga. So now maybe we can move on to Dr. Ben. Maybe you can elaborate your journey. I heard that the specialist pathway in Singapore is much like the US, where it's called residency. So, okay, so
Yeah.
maybe Dr. Ben can elaborate on that. Thank you,
Thank
Doctor.
you, Nicholas. I think the word illustrious was quite accurate, right? I think as Professor Shanga was sharing, uh, it was a journey of wisdom, right? So I think Prof. Shanga's talk really illustrates that sometimes being a urologist isn't the destination, right? The urologist that Professor Shanga is today is very different than if he did the direct route. So I not as illustrious, I would say. I started off wanting to do surgery, And so I belong to the old system where you use the UK system, which was basic surgical training, and I finished that in surgery. And then we moved, that was 2 years at least. Sometimes 2 to 5, depending on how long you take to finish your basic surgical training. Then you move on to your urology advanced surgical training, which is usually 4 to 5 years. And then when you finish it, you can then so after your basic surgical training, you have to finish your MRCS. So I did MRCS Edinburgh, and then you did a Masters of Medicine for surgery in Singapore. Then after the 4 years, we did the similar FRCS Urology Glasgow, 2015. And then 2016, I finished my local Singapore exam for urology, which is the Fellowship Academy of Medicine Singapore for urology. So, so at the shortest, it was a 2+4, but most people took about 8, 9 years to finish it. And then what happens is usually after finishing training, we needed to do a fellowship overseas for at least a year. And so I did my Royal Free in London. And then finally you'll come back and then you will do surgery. And the system that you're alluding to now is the residency program, which is taken from the US system. And so you start and you enter residency often after you finish your housemanship and 1 year or half a year as a medical officer with the department. And then there will be a 6-year training program, which is quite similar, 2 years in surgery, 4 years in urology. In between, you will do electives like emergency medicine, pediatric surgery, you do attachment to other hospitals to complete all your rotations. And then after that, when you finish now, you have to do 2 to 3 years of associate consultant. Then you go for a fellowship, which can be 1 or 2 years, and then you come back. So along the way, some individuals will also do extra academic studies. You can do a master's of public health. You can do a master's of clinical investigation. And some of them will take time off to do a PhD as well. So then that is the point where you get gazetted as a urologist, right? And actually life continues after that, where you continue to then subspecialize into individual subspecialty in urology. And as I had discussed earlier, there's actually a whole spectrum of what you can subspecialize into. So I subspecialize, so like Professor Tiong is online now, and so we both subspecialize into the kidney part of urology as the main focus. So both of us do kidney transplant, kidney tumors, kidney surgeries, robotic kidney work, kidney stones, kidney reconstruction as well. So then you choose a subspecialty. Most of us also then choose like a secondary career, which is why I am doing a lot of education. And so like Prof. Shanga, I did quite a bit of surgical education in the beginning, and then I went on to do as the undergrad director for surgery. So ran the entire surgical program for the medical school for Singapore. And then now I'm doing the assistant dean role where you take care of student well-being, student development, student leadership, and programs like this, right? Whereas Professor Tiong went down the path of research, where he publishes numerous papers, doing a lot of clinical trials, MedTech, MedEd, And so there are many different paths that you can take after that. Yeah.
So just to summarize, like how long did it take you specifically to become a kidney transplant surgeon?
So to urology, I did a 2+5, so 7 years to be a urologist, and then another 2 or 3 to become a transplant surgeon, so 10.
So both doctors also took quite a long pathway. So if you don't mind me asking, how old are you now, Dr. Ben?
42.
42. Yeah, okay. It's still quite in the prime ages.
Well, sometimes it doesn't feel like it, but okay, I'll take it.
Okay, so that was a very informative explanation on the journey and the current pathways. So now, could doctors outline the main key differences to specializing in Malaysia and Singapore? Like if a student wants to specialize in either one countries in regards to the requirements, the recognition of the degree of MBBS, and the application process? Maybe we can start with Dr. Ben.
Your question is how to be a specialist in Singapore.
More like the requirements of being able to apply and the recognition of the MBBS degree. Like I heard only Singapore only recognizes certain degrees from certain universities in Malaysia, namely HUKM and UM, and also the application process. Like how do you go about applying it?
Yeah, I think you're right. There are specific sets of university that is recognized to practice in Singapore, and I think that list changes. You can find that list online quite easily. And so I think the first step is getting into the healthcare system in Singapore, usually as a medical officer doing rotation. Most specialties in Singapore and probably in Malaysia are very competitive. And so the department will want to work with the individual. So usually you finish your training, get into Singapore, either as a house officer or medical officer, work a couple of years, get into the department of interest. And then if you perform well, you can then apply for training in that hospital or department. Yeah. I think it's quite unusual for departments to take trainees or residents that they have never worked with before, fresh out of another country. I think it doesn't happen like that across the world.
So the main requirements are to graduate from a recognized university and to have some experience in Singapore beforehand and get recommended first lah.
Yes, so you need to get experience, but you also then need to have working experience with the department of interest. So you then decide which is the department, which hospital you want to work in. Most of our foreign, because Singapore has about 30% foreign doctors, right? And so it is quite a large proportion of our working force. And most of them would take some time to find, I mean, it's at a point in your life where you're 20 plus, you're trying to find out what you want to do in life. Then you got to figure out which hospital you want to be. And then you got to figure out what is it you want to sort of further explore and really do. So it takes a bit of exploration.
How about in the terms of the requirements, like maybe you have to have publications beforehand or involvement in student societies? Are those an important factor as well?
Yes, to a certain extent. I think it's not so much the number of publication, but the demonstration of academic ability to critically appraise journals and then to be able to contribute to that body of research. So it's not it's not a magic number where you need 3, 5, 10. It's more the fact that you need to demonstrate that I'm able to critically appraise scientific publication, understand what's there, and then a demonstration of that would be to pick an area of interest to then write about it, such that it is recognized in a peer-reviewed international journal that, okay, this individual is able to understand what is needed in the literature, what are the gaps, and therefore has contributed to it. So it's more of that than say collect 10 or collect 15 kind of thing.
I think that's a much better approach compared to the US because I've read a lot of articles in the US where they always publish out the average number of publications a medical student must do in order to match into a certain residency in the US. So what you're saying is the Singapore system looks more at the quality and the caliber of the participant of the applicant itself rather than just the numbers lah.
Yes, I think multifaceted. So research is one domain, education. I think very important is when a department chooses somebody, they choose somebody that they want to work with and want to train. So being teachable, trainable, willing to learn, being passionate, being dependable, they're important qualities, And so we have people who publish a lot but may not have a lot of these qualities, and we have people who have a lot of these qualities who may not publish a lot, right? So it also depends on whether you're applying to an academic institution, like a university hospital, or you're applying more to the other hospitals in the other parts of Singapore.
I see. Thank you for that very very in-depth explanation, Dr. Ben. So now, Dr. Shangam, could you give your comments on the requirements and the degree of recognition? Like say if a student from a university in India, but who's a Malaysian, wants to come back to specialize in say urology, could they do that, or do they have to take an extra exam and the application process?
Okay, so somebody coming from overseas, I think the most important thing is you must make sure that the university that you are graduating from is a recognized university in Malaysia lah. So that list is always available in the JPA website actually. Yeah. So I think most of our parents who send their kids will send to recognized colleges lah. I think so that shouldn't be a problem. And of course, there are pathways for those who are coming back from unrecognized universities and all to recognize them and all that. But those are all has become very less now, because not many are going to unrecognized colleges anymore. Okay. And I think the first thing that we have to see, I mean, we are all these, the participants here today, we are all all of you are undergrads, isn't it? You all are still studying, you all are, I think the first step that you must think about is joining the housemanship in Malaysia. I'm talking about Malaysia specifically. Yeah. So the natural pathway for you all will be to pass your exams and then to join the housemanship program. So the first challenge is there, to get into the housemanship, which is a 2-year program with rotation to all the main departments. And you must know the dropout rates are quite high nowadays. Our I think the latest figures, like 20% do not complete their housemanship. They drop out halfway, they resign, and maybe another 15% gets extended. Another 15% of our house officers are getting extended because many reasons like coping or maybe not attitude and or a lot of many reasons we won't go through the specifics, but that is the big challenge that we all must pass through first. And you must know recently what problems we are having with housemen is many of the undergrads are not even signing up to join as housemen. They are looking at other career opportunities after passing MBBS already. Already they are looking at so these are challenges. First get into the system first. First get into the system, complete your housemanship. While doing your housemanship, you will go through many postings and you develop your interest on what you want to do. Okay. Then of course in Malaysia there's something called compulsory service. So you need to go out and do you need to complete your compulsory service in order to be eligible to apply for a specialist program. Correct. So I'm sure you're going to now come and ask me later the contract issue and all that lah. So that we'll come to that later if you ask me. But in order to get into a specialist program, you actually need to have a minimum criteria of 2 years post housemanship, okay, which is actually your compulsory service lah, okay. And you need to sit for the MEDEX exam. We have a MEDEX exam, which is a qualifying exam. We have surgical based and medical based exams, and you need to get at least band 4 or band 5 in that exams. Okay, once you qualify for through MEDEX and you have done 2 years post housemanship, you become eligible to apply for a specialist program. But of course, when you want to join the specialist program, you must have exposure to that particular field that you are applying for. Like for example, urology would require you to have at least 6 months of rotation in urology. We don't want to take somebody who has not been exposed to urology at all and then suddenly join the urology program, find themselves not interested. Hey, actually, this is not what I'm interested in. Then you got dropout and you got failures. So we don't want that. You must expose yourself. So the challenge is, of course, to get rotated to urology. That is another challenge for our doctors, actually. Let's say I'm interested in urology. I'm posted in Temerloh somewhere, and there's no urology in Temerloh. How am I going to get myself into a urology unit in Kuantan, maybe, So that rotation must happen. So how to do that? That's a challenge. I fully understand the challenge our doctors are having as medical officers, but somehow the way to do this is to go and appear for some exams like MRCS and all that, and let the management know that I've already done my exams, I want to join this program. So they know that you are committed, to this, because you have set for exams already. So they need to rotate you to these particular units and all that. So that's how you control the system, not not the system controls you, So you have to make things happen for yourself. Cannot just wait for it to come and fall on your lap. As far as Malaysia is concerned, you have to move things around. So go and sit for exams. And of course, as you perform well in your house officer postings, or when you go as a medical officer, your bosses will definitely help you to move you on to other specialties and all that. I think Prof. Ben explained just now of joining the university hospitals. So if you want to join university hospital, then of course universities always advertise for medical officers actually. Okay, we want medical officers to join the surgical department. So you can apply actually. And when you want to join university hospital, that's when the question about your academic interest, your academic inclination, all that will be taken into account. So maybe try to publish some a paper will put you at a higher level actually. When a university hospital interviews you, of course we will look at the academic credential of the applicant, isn't it? Compared to when Ministry of Health is interviewing you for a master's program, they might not look at it actually. They might not look at your academic, because there they want service. They want you to be able to operate. They want you to be able to run the clinics. They want you to run the service, you see. But when you are applying to the university, they will say, okay, you run the service. Yes, that is one part of your job description, but you must also be able to publish or lead in the future a pathway for people, your juniors, to publish under your supervision or something like that. So you must show some academic inclination to look a bit higher than the rest of the applicants. So once you join those program and you apply, then you can get into the specialist programs already.
Thank
For
you,
sharing, Professor. I am wondering, in Singapore, to become a specialist trainee, they need to be a Singapore resident or a permanent resident of Singapore. I'm wondering, for Prof. Shanga, do you know if the similar requirement for Malaysia, must they be like residents or PR of Malaysia to get into a training program?
Actually, have to be a Malaysian citizen, that is for sure, because all our program is under the Hadiah Latihan, that means a scholarship from JPA. So if you are a private candidate, of course, you can be a non-citizen also, you can apply to join the specialist program as a private candidate. But that will only be permissible for those private candidates who are non-citizens coming from recognized medical colleges around the world, which is in the JPA list actually. Because if you are coming from a non-recognized medical school, you will not get a practicing certificate in Malaysia. So then they cannot join any of the programs.
Yeah, so that's fairly similar. Thank you.
Okay, before we continue, I would just like to say that we are happy to have a surprise guest here today. We have Prof. Tiong here from NUS as well. So hope Prof. Tiong will enjoy the discussion between Dr. Shanga and Dr. Ben. So now moving on to now coming back to what Dr. Shanga was saying. Yeah, I'll definitely ask you about the contract issues later on, but that's for later. So in terms of like the requirements, like just now you're saying about academics and the academic side, like the university and KKM side, but I've also heard there was like a scoring system where they will award points to applicants based on the number of research they have or student society involvement, oral presentations. So could doctor maybe comment on that? Is that a very important thing then?
You're talking about joining a university hospital, or you're joining a
Just the masters in general, like from
Okay.
the KKM side.
Definitely there is a checklist of important items that you fulfill that will make you stand out as an applicant lah. But I'm not sure of any point system in my department. I don't think there's any point system. We go by you need to fulfill the minimum criteria, and you come in for our entrance exams as well as an interview. Okay, so and we go by the top, like if you have 20 slots for that year, we go by the 20 top students lah, who fulfill this criteria and all that. But of course, during the interview process, you will score well if you fulfill all those criteria that you just mentioned, because that will make you stand out as a potential candidate for us to take, you see. So the idea, the most important thing is to stand out. How to stand out? Do all those extra things, you know, isn't it? But
Yes.
that is not the end all kind of things. At the end of the day, you need to perform on your exams and your attitude and your interview and all that. And also because nowadays we have the basic surgical training modules under the College of Surgeons. You also need to fulfill all those assessments, something like a work-based assessment, to show that you are actually inclined towards surgery or whichever field that you are choosing.
I see. So, like Dr. Ben's side of the story is a very multifaceted selection process lah, which is
Yes.
quite good because it will really filter out the ones who just talk for show and say they want to be a surgeon and those who really, really want to be a surgeon.
The most important thing is your exposure to the field that you want to choose. I think Prof. Brand also stressed just now, you have to have some exposure before you decide. Let's say you were working in medical for 2 years of your MO-ship, and then suddenly you want to do surgery, You apply for surgery because you didn't get posted to a surgical rotation for some reason, service requirement in that hospital, but you're always interested in surgery. Do not rush and do surgery because you actually do not know the challenges of that particular field that you are choosing out of your interest, of your childhood interest, or oh, I always wanted to be a surgeon. I always wanted to be a cardiothoracic surgeon, or I always wanted to be physician because I saw House or something like that. So, you always have exposure to that field that you have chosen.
Just hands-on lah in general.
Yeah, because we as examiners and all, we see the dropouts of the courses, Who are those who dropping out, or are those who have very minimal touch and go kind of exposure to that field? Those are the dropouts actually.
And I always hear the trainers of the master's program saying that they really, really do not want to accept someone who might potentially drop out because it's a real waste of time and money and resources.
Absolutely, yeah, absolutely.
So now moving on, could both doctors maybe elaborate on the training program as a whole? Like what does it entail? Maybe specific core surgeries or procedures that you have to do in training and be proficient at before you are passed. Maybe you can start with Dr. Shanga on the Malaysian side.
Are you talking about urology or?
Urology.
Urology. Okay, so once you join urology program, it's a 4-year program for parallel pathway. So you sit for exams in the 4th year. Okay, so our training, of course, we have core index procedures that you need to be able to do every year of your progression within the training program. Okay, so like for example, in urology training year 1, you would be expected to at the end of year 1 be able to do first of all, as you enter day 1 in your urology training, you are entering, what are you expected to be able to do? Okay, we would expect you to do of course simple things like catheterization safely. You would be expected to do flexible cystoscopy. Why I can expect my candidates to be able to do a flexible cystoscopy is because I would have expected them to have 6 months of rotation in urology before joining my program. Okay, so they would have done year one, day one candidates should be able to do some basic urological procedures, which could be maybe a cystoscopy, at least a cystoscopy actually. Yeah. So, or maybe bladder washout kind of thing, we would expect you to do as day one candidate. Now, at the end of year one, you probably be able to do some endoscopic procedures like URS, stenting, RPGs, retrograde pyelograms. So all those you are expected to do in year one. Okay. And at the end of year one, you probably be able to independently do this thing with minimum supervision by your trainer. Okay. So in year two, we would probably expect you to do a TURP as an index procedure, and all those open procedures like scrotal exploration, and like orchidectomies for testicular cancers and all in year two. Okay, so I'm just being very brief here, but of course the list can be longer. But in year three, probably you will be doing more complex endourological procedures like PCNL, and in year four, maybe some exposure to laparoscopic already, at least initial laparoscopic mobilization and all that, And then we have the subspecialty procedures like transplant, robotics, and all will come only after that, actually. But of course, during your training, you will be assisting all these procedures that your supervisor is doing as his specialty, but you will be assisting all that. But as a core index procedure, you are expected to know, be able to do independently when you're passing out on the 4th year, at least a PCNL, initial laparoscopic work, as well as all the other basic endourological procedure. I'm very interested to hear how the Singapore system expects their candidates to be performing at the end of 4 years.
Thank you, Professor Shankar. So, I mean, when I hear you speak, I think there are similarities. In the Singapore system, we classify into the basic surgical first 2 years. And so our residents spend the first a year and 9 months in general surgery, including pediatrics. They may do some emergency medicine to attune them to traumas, emergency situations, how to deal with the sick patients. They spend some time in critical care, so either in the high dependency unit or the ICU, to expose themselves to critical care management of sick patients. So the first 2 years are very foundational. Often they would have done about 6 to 12 months of urology, like you rightly mentioned. And so it's just to add on, to layer on the basic surgical aspects, including emergency and critical care. What happens is during that 2 years, they will do 3 months of urology to keep their hands warm. And similarly, we would expect them to do the basic procedures, cystoscopy, basic. The principle is they start in the open space, so they help in the open procedure, and as they progress to intermediate, they will do endoscopic procedures, so ureteroscopies, laser lithotripsies, they can do TURPs for the prostate, TURBTs for the bladder tumors. And so these are where they start. And then the last 4 years, they will come back to urology. We have 2 hospitals for them to work across. They need to do 6 months in a general surgery subspecialty of relevance. Most of the time colorectal, because we deal with a lot of colorectal procedures there. Sometimes hepatobiliary or vascular because of the IVC or the vascular aspects, depending on interest. But most of the time, colorectal surgery for bowel resection, when we do ileal conduits, when we do neobladders, when we accidentally injure the bowel. So they spend 6 months in colorectal, if not some other surgical procedures. They then do usually 3 to 6 months cross-hospital rotation. So they go to another cluster in Singapore to get exposure. Like I said, sometimes during this year, they take 1 to 3 years out to do a master's in clinical investigation or PhD. And then by the time they finish, traditionally, we would expect them to do all the endoscopic and basic open surgeries. We try to ensure they can do a laparoscopic radical nephrectomy, so a keyhole surgery to take out the kidneys. We also try to make sure they can do a PCNL. So we will train them towards there. Having said that, nowadays with technology, maybe retrograde intrarenal surgery, the scope into the kidney to laser the stone is more common, and we may change in that direction. During this period of time, they will also spend a lot of time assisting robotic kidney surgery, robotic prostates, and so they get familiarized with the platform. And like Professor Shanger said, it will be a fellowship training to get robotics or advanced complex stones or transplant or advanced neuro-oncology. So quite a spectrum. I think the most important thing is, like most specialties, residents won't do anything that they are not trained and ready for. There will be stepwise progression that's level appropriate. There will be multiple checkpoints using the residency system of milestones to make sure they are competent so that eventually they can do the activities that's entrusted to them.
The interesting difference is, I think on your part, Prof. Ben, the colorectal and bowel work comes within the urology. They get posted to the colorectal unit during the urology training, isn't it?
Correct.
On our
Whereas
part,
your side, they already finished the training.
yeah, they already done the general surgery rotation and done bowel work before coming into the thing, and then we just polish it as trainers, lah, so we just polish their.
Yeah, and I think having finished general surgery will certainly make the urologists in Malaysia more comfortable in the abdomen pelvis region. That's
Correct.
one of the reasons why I did transplant, because transplant, when you go in for multi-organ procurement, you actually go all the way to the liver, we open the heart, so it makes you familiar with the intraperitoneal and retroperitoneal space, which if you have done your general surgical training, actually it's very standard, right? It's a minimal requirement almost. Yeah. So that's the main benefit of the Malaysia system, I think, having recognized that that takes more time. And nowadays, everybody seems to be in a rush for time.
Yeah. So now, like, that's a big difference, because when I joined, I was already a surgeon, very well exposed surgeon, fully trained surgeon, and become a urologist. And there's a difference with the newer generation now, who are just having rotation in surgery for a year, and then they become urology trainee. So you can see the entry of a surgeon, fully fledged surgeon into urology, and a medical officer entering urology. So you can see so the training will probably within urology to specialize to be able to do complex urology work may take a bit longer for the current trainees. So we adapt better actually, yeah.
For sure. And around the world, they're going down this direction of like subspecialization. So they don't expect urologists to do bowel work or take out the gallbladder or take out the spleen anymore.
Yeah.
Okay, so now, thank you, doctors, for that very, very in-depth explanation outlining the differences, the key differences of the training program and structure in urology in Singapore versus Malaysia. So now I would like to ask the question that Prof. Shanga has predicted, the governmental issues or the healthcare issues. So since we're all, not all, mostly Malaysians here, maybe we start with Singapore because it's still an unknown entity to us as of late. So maybe Dr. Ben, could you outline the main healthcare issues in Singapore?
Main healthcare issues.
In terms of maybe like employment or maybe oversupply of medical graduates, those kind of things.
No, I think Singapore main issue is aging population, right? I mean, in a developed country, the main issue is aging population, and with that, cardiovascular disease as well as cancer. So urology is a very geriatric type condition in its later stage, like prostate, having problems, prostate cancer, renal failure, they tend to occur much later in life. And so a lot of my patients are quite old. And then, of course, you have the young ones with the stones and the pediatric urology. The move in Singapore now is trying to move from disease to health. So how can we move from, taking care of disease all the way to taking care of keeping people in health? We are also moving from hospitals into community. So how can we move healthcare from treating tertiary complications into actually how can we manage this at the community level and keep them well and at home, right? So that's the big move. And so primary healthcare and things like this is there. I think like healthcare organizations around the world, we are always short of medical officers. We're always short of doctors. The challenge is actually we are short of people in the middle strata, so medical officer all the way to registrars. And so the doctor to patient ratio in Singapore is not too bad, and we are trying to improve it, and hence we are trying to always get more doctors. And so besides specialists, we have a lot of other alternative pathways like hospitalists, resident physicians in general surgery, people who come for fellowship, people who come just do rotations. And so I think there are lots of avenues in. There is lots of gaps, bearing in mind the larger directional move of the country, right? So, and urology is actually demand. I mean, our wait time is getting longer and longer, even though we are opening more and more clinics. I think because there is a demand for the services.
So I also have another thought because in the because just now, Dr. Ben, you said that is from the residency system is from the US. So how about the healthcare system in Singapore? Is it like in the US? I heard in the US there is no such thing as subsidized healthcare. So is that the case for Singapore as well?
Singapore is an interesting healthcare model. So the US, they spend about 20% of their GDP on healthcare. Singapore adopted largely from a UK healthcare system, which spends about 10% of its GDP on healthcare. What Singapore does is it blends the two and it provides, so it's not really the European free healthcare, but it's not really the US capitalist insurance-based private-only healthcare. It's somewhere in between. So there is subsidized care, which is probably about 80%. Private care is 20%. And we spend about 4 going on 5, going on 6, 7% GDP on healthcare only. And recently we have one of the longest expectancy in the world, right? So it's largely government funded. So there is subsidies for subsidized patient and the 80%, but all patients need to co-pay a certain amount. And when you co-pay, there is a certain stake in consumption, because in the one healthcare where it's fully insurance-based and private in the US, people just consume whatever they need and it's money, it's all a game about how do you optimize the money used for the insurance you pay. And in the European side where it's completely free, there's also issues about healthcare utilization and rationalization. So Singapore is sort of trying to find the in-between where for those who can afford insurance and get private. For those who can't, you get subsidized healthcare, for which there's a spectrum, and then additional support if needed. There's always a co-payment element. And so when you have to pay out of pocket for 20% of the bill or 10% of the bill, it is financially often affordable, and there is more stake and ownership in the healthcare cost, and hence it's more judicious use of it. So it's in between.
I see. And I think that also, how you say, instills some sort of discipline in the citizens as well, not just want to simply claim MC, go and see doctors, simply claim MC from government clinics like it is in Malaysia sometimes. So
Singapore also have, it's basically paying for MC. You pay for
basically paying.
You sit there for long enough, at some point you will get one day. Singapore is then moving away to each employee, most companies now get 2 days of sick leave without needing an MC. So the hiring policies have changed to reduce the unnecessary strain and consumption. So 2 days a year, you are entitled to say, I'm not feeling well today. And we trust that you are a passionate, competent individual in the organization who's not feeling well, and we don't need you to go and see a doctor to give you an MC and pay the extra money if some sleep will make you feel better. So there is some policy changes that I think has significant impact, right? Because if all 5 million people takes 2 less doctor visit a year, that's 10 million visits a year. So that helps, and I think it's a good step forward.
Yeah.
And then the SGs and other steps to make sure that they take care of their health, sleep enough, the diet, the exercise.
Yeah, it's definitely a good collaboration between two different industries to alleviate the stress and burden on the doctors in Singapore.
Yeah, and we have a long way to go. So it's a good start. Yeah.
But at least starting somewhere is already half the battle won. At least, yeah. So now moving on to Dr. Shanga, maybe you can outline also the healthcare system in Malaysia between private and government, and also the issues faced in Malaysia.
Okay, I mean, I would just echo what Prof. Ben said lah. Shortage of doctors is always there. But the healthcare system in Malaysia, of course, there are three tiers. One is the Ministry of Health healthcare system, Ministry of Education, controlling all the university hospitals, and the private healthcare. Okay, so you all will know that our healthcare system is a very highly subsidized healthcare system actually, despite having lots of private hospitals mushrooming everywhere, but the majority of our healthcare provision is by subsidy from the government. So top of my head, I cannot remember the percentage of the GDP that is allocated. I think it's in the range of 35 to 40% of the GDP is allocated towards healthcare. But it is a very highly subsidized healthcare system in the Ministry of Health, where the patient goes to the hospital, hardly pays anything actually. They only pay 5 ringgit to get specialist healthcare with all medications, whatever procedure needs to be done, everything is not is covered by the government actually. So that's how subsidized the healthcare system is in Malaysia. And if you go and see primary care, you only pay 1 ringgit actually, And this 1 ringgit system has been there since the start of time, I think, since our Independence Day, if I'm not mistaken, So there's not been a revision. There's always been considered a very good healthcare for the public, So maybe that contributed towards the lepa attitude of our public in not taking care of them. Say, yeah, healthcare is so cheap. I just go to the government hospital. So clogging up the government services and all that, so that is our challenge, and government has of course moved very much forward. Now our primary care centers and all are well manned, very excellent. I'm sure if you all are from the KL region, Klang Valley region, if you go to some of the healthcare, the clinic kesihatan around our Klang Valley, it's fantastically run, They even open till night, their clinics, and they have specialists there. Primary care physician is there, specialist level, and it's all almost free of charge actually for the public. Okay. Then we have the education system, university hospitals, who are partially funded. Now this is partially subsidized. So there is a cost to it. If the Ministry of Health the hospital charges 5 ringgit, the Ministry of Education hospital charge about 15 ringgit for consultation. And the medicines are all not free. There are costs to all those. So coming to a university hospital incurs some cost for the patients lah. Okay, and of course for government servants, we have civil servants numbering about 1.8 million people in Malaysia are civil servants, and their dependents are all free of charge actually. So no cost to for any procedure we do, except for some consumables that are not because of those economic downturn and all this newer technology coming up, of course, the government cannot fund all these newer toys that the doctors want to use. So then the patients has to pay out of pocket. And then the other healthcare provision in Malaysia is through the private healthcare services, which of course people with insurance, no issue. You can use a cashless system, walk into a private hospital, which is in your panel of is a panel hospital for your insurance provider, and you can just get your consultation or procedure or whatever done in a private hospital. And of course, a lot of Malaysians, because of the waiting list in the government hospitals, government services, we actually, they actually decide to fork out the money, even though they are not insured, they fork out the money and seek private healthcare in order to speed up their management actually. So that's the difference lah, yeah, in Malaysia.
So, doctor, having said about the clinic kesihatan, the one ringgit treatment and consultation, everything. So, do you think that contributes to the contract issues we have today? Because my perception is that the government is not giving enough funding to the healthcare system to create permanent positions or offer more permanent positions, or is it my perception is wrong and there's another side to the story? What is your perception of the contract issues today in Malaysia, doctor?
No, funding is always a problem lah. As far as, I mean, you hire people, you need to pay them, you need to have funding, you need to have posts and all that, isn't it? So funding is always going to be a problem. Funding can be manpower funding, services funding, logistics funding. There's so many what do you call that? Subheadings for funding. But I think the contract system all started, when was it? 2016 or 17, if I'm not mistaken. Around that time, actually, there was the reason why the contract thing came up is because, of course, it's just my opinion lah. I think it is because at that moment we thought we had too many doctors in the system. So you need fund to pay all these people. So if you convert to a contract system, that means you only commit to pay for a particular period, and then you can actually get those doctors out of your payroll, and you can bring in new people. So that was the initial idea, I think, why we converted from the permanent post for all doctors, without any, you don't even have to think, you come in as a doctor, you pass out, you get a job, and you are a permanent staff of the government. And then we have so many medical schools. Can you guess how many medical schools we have in Malaysia
I
for
think
a
we have
population of 30
about
million?
30 plus.
Yeah, we have about 32 medical schools actually. My last count, I think maybe every 2-3 days might increase. So you actually got so many medical schools. We are higher than the UK even. So you see the number of medical students coming back, numbering about maybe 4 to 7,000 per year. 1,000 coming from overseas every year. So that period where they couldn't pay anymore, the funding was not there. So that's why the contract system, I think, came about lah, and so that we can get people off the government's payroll, and then you look for your own job and look for your own thing. But that of course contributed to a lot of animosity among our doctors. A lot of disgruntlement and complaints and protests and all that lah. Because the future was not there anymore. How to join a specialist program? You can't join a specialist program if you're not a permanent staff of the government. But of course, government is making arrangements to allow those who are on contract to apply for postings as well, for specialization training as well. So that's how the government is moving forward. And also because of the multiple discussion between all the stakeholders, I think the number of people getting permanent posts also are being increased every year so that more people will be absorbed into the system. And I believe with the current shortage of house officers joining the services, I think there'll be more options for people to be offered permanent posts, and hopefully one day we'll go back to the old system of automatically providing permanent posts to our doctors.
I've also heard that doctor, usually those who are retained, offered permanent positions are those that perform well and do not have disciplinary issues. So is that the case, or is it just maybe randomly or sometimes based on favoritism or workplace bias, those kind of things?
There will always be this kind of talk, isn't it? There will always be this kind of talk. I tend to believe that disciplinary issue is of course going to be a problem, lah. Discipline. If there is a system where they need to choose, let's say there are 100 people become eligible to be either given permanent or from this 100 cohort of 100 medical officers, So I think, and I only have 60 posts, for example, and I have to, select 60 out of this 100 for permanent posts. I think the government will definitely use some criteria, performance-based criteria, disciplinary criteria. Maybe the publication may come into the issue, your contribution to the society, all that will become an issue that again make you stand out to be selected. But whether there's bias and favoritism and all that, there will always be talk like that, lah. But I like to believe that as doctors, we are all professionals. We should choose the best to provide service, because I want to be treated when I become older, I want to be treated by somebody who has been given a contract or a permanent post or a specialization post on merit, actually, isn't it? Not through the
Yes,
back door. Yeah.
very much so. I also understand. I wouldn't want to send my aging parents to someone who has disciplinary issues,
Yeah,
those
correct.
kind of things. Yeah. So that brings us to the last discussion topic. It's a bit superficial, but I'm pretty sure realistically all medical students want to know this before pursuing a specialty. So maybe we can start with Dr. Ben. So could Dr. Ben maybe outline the lifestyle, like the working hours and the patient experience and the compensation for the different systems in Singapore for physician compensation? So yeah.
Thank you. Lifestyle. I would say that urology is a surgical specialty with a pretty good lifestyle. And this is even somebody who's doing transplant. So I'm on call with Professor Tiong 24/7. So it's a matter of perspective, right? Lifestyle is a matter of perspective. And so I feel that as a specialty, it is broad, like I previously mentioned, and there is individual choice and agency to say that, okay, there are other aspects of my life that's important. For some, it may be hobbies, for some, it may be family. And truth is, work is one part of life, but it's not all of life. So actually, the truth is, if we know what is important to us in life, then work, regardless of which specialty you choose, will be one part of it. So I have a very rich and busy life outside of medicine and even outside of my education portfolio, right? So I think, and I've seen colleagues in other specialties who also do that, and that's an active choice, right? Whereas some choose to really hone their craft and be 100% involved in surgery and medicine, and that's also okay because it is a choice. And remuneration-wise, I think Singapore's remuneration is not bad. It's not the highest in the world. It's probably mid-upper area. Having said that, I think the cost of living in Singapore has really gone up in recent times. I think Malaysia as well. And so I don't think our salaries have gone up in the speed of inflation recently. So I would say overall, if someone is a doctor in Singapore, They don't make the amount they used to, they would in olden times, and it will be comfortable. It will be okay for you to do what you need to do.
Okay, thank you, Doctor. So maybe Dr. Shanga can comment on the situation in Malaysia, the lifestyle, everything.
Okay, the lifestyle of a doctor is very individual. I agree with Prof. Ben actually. You can decide, but you can only decide when you are more senior, lah. You know, when you are more senior, you can decide what you want to do, how you want to take your life towards achieving work-life balance and all that. You have the autonomy to decide that when you become very senior. Okay, like us lah, now we can choose what we want to do, and we can, and we must always ensure our juniors are well trained, to handle your job actually, so that you must train your juniors. You cannot be very, hey, I can do, I want to be holder of this particular procedure, only I can do, and then you will be very busy lah, because anything like that happen, they will only need to call you. So if you're very selfish like that as a consultant, then gone. Your life is gone. You won't have everything they will call you. So you must make sure that you train. You have been trained. You also must train somebody, and you must make sure they are probably, you don't have to be feeling bad that your juniors might be better than you. That shows that you are a good trainer actually. Because new things come up, your juniors will pick it up, and then they will be able to do the job. So then your work-life balance will improve. But let me tell you, you cannot expect, it is wrong for you to expect good work-life balance when you are a trainee. If you think, oh, I'm a trainee, why I'm going to get all these donkey job they have passed to me, I don't want, I cannot, and then you feel very bad and you feel depressed and all that, then please don't join any training program. That's reality for you, lah, That's reality. Sometimes you can have nasty bosses, Ben, don't you agree with me? You will get one. Throughout your training years, you'll get nice boss. You'll get very sarcastic boss who will ask you to get out of the theater if you don't know the case on table. You forgot something or what. You will get all this. All these are part and parcel of training. So you cannot expect good work-life balance in training actually. But once you become senior, you can dictate and you can decide what you want for yourself in life. And then you make sure you pass on your knowledge to the rest, so that they won't be calling you, hey, I cannot do, you only have to come. Then you have to go lah, no choice. That shows that the senior has not managed the manpower well. So that is how you, because doctor's life, right from the off, busy. That's it. One word only, busy. I'm busy. So you dictate your own life towards as you become more and more senior. Remuneration wise, when I started as a houseman, my first paycheck, 1,713 Malaysian ringgit. 1713. I'll never forget this 4 digits actually. 1713 was my salary, first pay, ringgit Malaysia, 1713 as a houseman. Now, houseman take home more than 4K starting pay. Okay. So things have improved. Things have improved. Of course, cost of living also have gone up, but things have improved. As when you become specialist and all, you will take home nearly about 12K, 10K and all when you are a specialist. For Malaysian standard, I think in a government setup, it's quite okay. But of course, when you become very, very, very senior and you move on to private practice in Malaysia, Ferrari is not even the limit for you, lah.
Yes, doctor, I've always heard many things about senior specialists or well-known specialists or those niche specialists, especially like heart surgeons, cardiothoracic surgeons, usually, or neurosurgeons, especially neurosurgeons. They earn upwards of 100, 200K in private, and it's really not impossible for them.
Yeah, but again, you decide your life.
Yes.
Because if you want to earn that much money, imagine you will be very busy.
It comes at a price. Definitely, it comes at
you
a
will be very
price.
busy. You cannot leave your practice. Everybody will be looking for you. You will have a very busy practice. Is that what you want? Depends on you.
Mm.
At the end of the day,
At the end of the day, the
outside.
Ferrari from your house to hospital, hospital back to
Yeah.
house, done.
Even you drive MyV also, you can reach hospital
Yes,
to house,
exactly.
you know. Uh,
Yeah.
yeah.
So
Thank
there's a
you.
lot of wisdom in there, isn't it? It's
Yes,
about
yes.
choice, it's about what we want in life. Prof. Shangas talk about succession planning.
It's a very, very realistic take, especially on the work-life balance, especially because we are young, you know, we still have a lot to learn. There's no such thing as I want to rest or whatever. We
Well,
have to learn.
in the European and the UK system, they believe in that. So in the UK and European system, they believe in work-life balance. And so when I was doing my fellowship, my house officer and medical officer came in after me at 9 o'clock, right? Their training there can take 8 to 10 years to finish the training. So there is no free ride in the world. If you want work-life balance, and the people in Europe and UK are happy to take 8 to 10 years to finish the training, 12 years. Some of them go back, have 2 kids, then come back and then do it. But when they're 35, they start their training. So it's possible. Something has to give. So we cannot. I mean, the first few questions you asked was how long does it take? What's the fastest route? How long can it fastest take? And then that would be then you have to pay the price on the hours that you put in, the training, because surgery is a skill. You have
Yes.
to put in the hours to ensure that you are adequately trained. And then there's another school of thought, which is a different system altogether, where they will take 10, 12 years to finish their training. And then that case, you work 40, 50 hours a week. Whereas we will probably used to work 100, 110 hours a week.
Okay, so thank you, doctors, for the very insightful experiences and explanation on lifestyles and compensation. Okay, so now we have to move to the Q&A session because we are short on time. So the first question, the most upvoted question is, are extracurricular leadership roles relevant in master specialist application?
Absolutely relevant.
Yeah.
It will all add weight to your application actually.
Yes. So it needs to demonstrate your leadership abilities and your ability to work with people. It has to be in the area of your interest. Now, we are seeing people's CV where it's very well padded and they don't seem very passionate about it. So it's a lot of doing it as a checklist or really doing it as a passion project. That along the way, you learn to work with people, you learn to work across country, the diversity. And I think it will shine through when you talk about your project. So you really need to be passionate and only do what you care about, rather than some people do it for the checklist activity. People see through that also.
Yeah. Okay, and the next most upvoted question, can I join parallel pathway in Malaysia if I'm a contract doctor? I believe already answered. Can. I think even Dr. Kyrie, the health minister at that time, he said we could. So on to the next question is, Dr. Ben, how did you decide to become a urologist?
Oh, I wanted to do liver transplant. And then after that, I spent many hours in the theater. And then I realized the urology, the main thing is the broad spectrum of it, which is really, you could do as much surgery as you want, really big time open surgery, cystectomy, new bladders, kidney transplant, or you can do all the way down to the micro, using microscope to do minimally invasive work. Or actually, like Prof. Shankar said, you can do office urology. You don't even need to go and do theater. You can do shock waves, cystoscopy, biopsies. So it's very broad range. And if you are somebody who likes to get your hands wet and do different procedures, learn different platforms, get bored quite quickly, then I think urology is great. So the urologists in Singapore are really, really nice as well. Everybody's friendly, everybody's nice. So I think that helps the environment as well.
Absolutely well answered question, that one by Prof. Ben. Exactly why urology is great.
Yeah.
Okay, so thank you, doctors, for answering the Q&A. So the rest of the questions, we do not have the time to go through them. So we will email the list of questions to both doctors, and we will email the answers back when we get them back to the participants later on. Okay, so this brings us to the last part, which is the photo session. So, M&D.
So thank you, Professor Shanga, for sharing your wisdom, and to the organizing team, right? To really, it's no mean feat to put this together on a Sunday, bring people together, first of its kind across 2 countries. And I've learned a lot today, lots of new insights into how the system across the streets work. So that was really interesting. So thank you.
Thanks, Prof. Benjamin, to you as well. Same here. I've also gained some insight on your health system as well, and I know what the students would want to know as well. So maybe as this will help me actually when I teach. Maybe I can include some life issues in my teaching uh, to educate them and to inspire them to become
Yeah,
urologists.
certainly. At the NUS side, under my office, we have a branch called Careers, where we help them do careers symposium, bring speakers in to talk about potential careers for medical students, but not just surgical or clinical, but also what are the non-clinical options. So that I think in the US, the medical degree is one of the most versatile. So
I'm so sorry to interrupt, doctors, but okay, so now we have to move on to the photo session before the timer runs out. So we'll give participants a minute or two to turn on your cameras with the provided backdrop.
oh, hello, so many of you. Hi. Hope it was good for all of you as well.
Another few more seconds. Please turn on your cameras.
Okay, so we'll be taking picture in 1, 2, 3. Okay, the next page. 1, 2, 3. Okay, so I pass back to Nicholas.
Okay. So I'll pass it over to Suzanne for her closing remarks.
Hi, everyone. Thank you for sitting through with us until the end, and thank you for joining today's event. So before we end, we just want to have a little promo on our upcoming event. It's called MMI Into the Future 5.0. This event, since COVID, it has been virtual, and this year we are coming back physically after a long time. So this, to let you guys know, is on 13th of January, 8:30 to 5:30, and it will be in UKM. So registration is open now, and we have like early bird, and also if like you're from UKM, you also will be getting like discount as well. And our normal price will be 50 ringgit. We also do include a lot of like interesting workshops and like talks, like to target on like the current health policies challenges in the healthcare system, like the contract system as well. So if you guys want to know more about it, do join our event. Registration is still open. You can still join us. Thank you. Pass back to you, Nicholas.
Thank you, Suzanne. So now this brings us to the end of our session. Thank you very much for participating and making this event a success. And a huge thank you to Dr. Ben and Dr. Shanga for taking time out of their busy schedules as academicians and as practicing doctors to deliver their wisdom and sharing their illustrious experiences with us. Last but not least, thank you to NUS Urology Interest Group for collaborating with us and making this event a huge success. So to the participants, please do keep up with our MMI social media pages for more upcoming events, such as the one that was promoted by Suzanne just now. And once again, thank you and goodbye.